Hello, I'm Olivia Von Tempo with Westminster WCAT, and today I have the privilege to speak with Rear Admiral Dr. Stephen C. Redd. Dr. Redd has over 30 years of public health and executive leadership experience. Former Assistant Surgeon General and recently retired from the CDC, Deputy Director of Public Health Service and Implementation Science, detailed to the White House to work on COVID response and worked with Dr. Birx. First of all, thank you for joining us. We appreciate you taking the time to speak with us today.
It's great to be with you here today.
You are currently retired, but can you tell us about your role at the CDC and with the White House?
I started work at CDC in 1985 after my medical school and residency training, and had several different jobs through the first part of my career. In 2006, I became director of a unit called the Influenza Coordination Unit, which was designed to make sure that in the event of an influenza pandemic, CDC could respond, all parts of CDC could work together in that response. That led to me being the incident commander at CDC during the H1N1 pandemic. A few years after that, I became director of the group that's responsible for all of the preparedness activities at CDC, the Office of Public Health Preparedness and Response. And in that role, we continue to work on responding to developing plans to respond to a large infectious disease outbreak. I had planned to retire after another job, becoming the deputy director at CDC for Public Health Service and Implementation Science. I had planned to retire from CDC in April of 2020, but when the influenza the COVID pandemic started, I worked for a couple of months on CDC's response, and then in early March was detailed to the White House from CDC to work with Dr. Debbie Birx on the overall government response.
So as we reach almost a year of COVID-19, back last March, how more specifically did your role change at the beginning of this pandemic?
Yeah, well, in the first month or 6 weeks, I was working for CDC, really explaining to people in Congress, elected representatives and their staff, what the problem was, what needed to be done, what CDC was doing. And then in March, I really stopped working for CDC and started working in the White House. So I was really not at all working for CDC, but working for the White House to make sure that the main things were making sure that the latest information was available to the task force and that we had the best predictions possible from the academic community on what was likely to happen, that we could forecast the effect of different mitigation measures, what needed to be done to slow the pandemic.
And like I just said, most people really sort of recognized COVID as a threat around the beginning of March. When did you first learn about the virus?
Well, China reported right at the end of 2019 that there were cases of a new, not previously recognized coronavirus that had occurred in the city of Wuhan, China. The initial reports were that it was from people who worked or had been exposed to a seafood market in Wuhan. And so that was really the first that I heard about it. It was unclear, there wasn't much detail. And a few weeks after that, we learned that there were many more cases and that there was human-to-human transmission. And that's when we knew we had a big problem. A lot of the information that came out after that unfortunately has proved to be true. How transmissible the virus is, the fatality rate, those things have been fairly stable since that time. The way that it's transmitted, we've learned a few things along the way, but really by the end of end of January, early February, it was easy to see that it was going to be a really big problem.
And what were your initial thoughts on the virus?
So initially, it sort of depends on when you say initially. At the very beginning, I was like, well, this is new coronavirus. We see these things. A lot of times they're small spillover events from animals, but the virus is mostly an animal, a problem for animals, not for people. When human-to-human transmission was identified and the high rate of transmissibility, the questions that came to my mind is how severe it is, the question of how the severity, and then whether mitigation measures, as were undertaken in Wuhan, whether they'd be successful or not. And I was probably erroneously optimistic that the first countries that had cases outside of China were able to put in place measures to control transmission. So in Singapore, in Hong Kong, in Japan, in Thailand, the first few cases were identified, and it was possible to prevent that person who was infected to come into contact with other people, so that the transmission was really contained. And I thought that was something that it was the way that the other coronaviruses had been controlled that to cause severe disease. SARS, which was a coronavirus that was identified in 2003, and then MERS from mostly from the Saudi Arabia and the Middle East, that was identified in 2012. That those viruses, even though they're transmitted from person to person, have been able to be controlled. And so I thought initially that we might be in that situation. Unfortunately, that's turned out not to be the case. We knew a few weeks after that it wouldn't be the case, with big outbreaks in South Korea, Iran, and Italy.
And how has your role as director of the Influenza Coordination Unit helped you prepare for this pandemic?
Well, I think that there are some ways that it did help, and maybe some ways that it didn't help. The things about this virus that were different from influenza may have made it hard to recognize some of the things that were recognized early on, but not fully incorporated into control measures. And just an example of that, the fact that this virus can be transmitted from people who don't have symptoms. That was something that was recognized in late January, and it eventually was kind of accepted as being true. But that delay was probably from people thinking that, well, influenza doesn't work like that, so maybe isn't the case. I think the broad outlines of an influenza pandemic and this pandemic are similar, that the virus is transmitted in the same way from respiratory secretions, either probably mostly from large droplets that when people breathe or talk or cough, drop to the ground within a few feet, and also by small aerosols, little particles that can float in the air and remain infectious sometimes for hours. That both of those things are probably at play, as well as transmission from surfaces that have respiratory secretions on them or have the virus on them. So that's the same way that flu is transmitted, but the difference is that the coronavirus that causes COVID is about maybe 50% more transmissible than influenza is, and is much more severe than seasonal influenza, with a fatality rate of 1% to 2%.
During this pandemic, we have seen both very dark days and some glimmers of hope. So what have been some of the more stressful moments, and then what have been some of the more positive moments for you during this pandemic?
Well, I think in terms of stressful moments, the first one was when it was clear that New York City was going to have a very big outbreak early in the response, in early March. Another stressful moment was the period at the end of April, when it was clear that it was going to be necessary to relax some of the restrictions that were in place, even though the virus wasn't really under great control. Another one, just kind of going chronologically, in early June, when I think this is not really, it wasn't really a scientific forecast, but there was at some level an expectation that there'd be a drop in cases with warmer weather. That didn't really happen, and particularly in the South, in Texas, Arizona, Florida, Southern California, there was a second wave of cases that didn't affect the Northeast the way the first wave did. So that was kind of a dark moment. In terms of positives, I think that the authorization of using the first vaccine in December was really that was really great. I think that was really faster than I was expecting we'd have a vaccine. The uptake has been good. The supplies, not what we would have hoped, but I think that's really a high point right now, is having now 3 vaccines that are available. I think the big risks going forward are that we're hearing about these days, virus variants that have mutations that may make them more severe or more transmissible, or able to evade the protection that the current vaccines provide. I don't think we know how that's going to play out, but the big risk is that the vaccine doesn't protect as well against these new these new descendants of the virus that have been circulating over most of the past year. So we're not out of the woods, but I think the drop in cases in the last month or 6 weeks that's been a real bright spot. Whether we're going to have a fourth wave or not isn't something that is knowable right now. But I think if we can vaccinate quickly and the virus variants don't take over, or the ones that are resistant to vaccine, we will. That's the roadmap to the end of the pandemic.
As if you don't already have enough on your plate, you have helped counsel Westminster with its COVID planning. What is your connection to Westminster? When and how did this connection start?
Well, I am a graduate of Westminster, so that's one thing. Both of my children graduated from Westminster a few years later, and one of my high school and college classmates is on the board of trustees. So I think that she talked with President Keith Evans and said Steve might be able to give some advice. So in August, we had a couple of conversations about what the school was planning. And so through the fall, I continued to consult with Westminster on what was happening. And I think the thing that has come out of that is, I think, something that was really questioned at the beginning of in July and August, whether schools would be able to safely reopen. And I think what Westminster has proved is, if you put mitigation measures in place, if the community can implement the mitigation measures to prevent transmission outside of school, and you can confirm that with testing, that schools can open. And yeah, it wasn't really a given. It was not really known if there would be outbreaks that would happen so quickly that the testing and the mitigation measures wouldn't be able to control that. But I think the school showed that can be done. I think it's a small part of the evidence base for the kind of the reaffirmation of the importance of opening schools that CDC has just has released recently. Try to get schools, especially the primary schools, to be able to reopen. In some cases without using the kind of testing that Westminster did, but the risk to students and to teachers and staff at Westminster has proved to be not something that the school has augmented transmission. I think that was maybe another thing, to go back to your earlier question about how the preparation for influenza has colored the response. The thinking and the evidence for school transmission for influenza is very, very strong, that schools are a kind of an incubator of community transmission, that children, as you guys know, come into close contact with many, many people over a period of time. And if they're sick, they can infect a lot of people. So with influenza, school closure is a part of the kind of the toolbox for control. It's turned out that COVID has a different epidemiology than influenza from that standpoint, and there haven't been school outbreaks the way that there were, for example, in the H1N1 pandemic, where schools were a major source of augmenting community transmission.
And in your conversations with many members of administration, what have been some of your thoughts or ideas that you have shared with Westminster that have helped our administration craft a safe in-person learning experience?
Yeah, I think really a lot of what I did was provide affirmation for what the plans were, and especially the testing that was being implemented, which wasn't part of the official guidance that any schools or CDC or the federal government was recommending. But I think that the school used the testing really wisely, balancing the cost of the testing, the frequency of the testing, and using those results to plan what the next steps were. Along the way, we talked about how this was an adaptive strategy, that the first round of testing, community levels of transmission were pretty high over the summer in Atlanta. And the first round of testing, there really were not very many cases detected. It was kind of a surprise that, to me at least, that there were so few cases. And I think Westminster followed that up to do testing at intervals that were affordable, and kind of continued to confirm that in-school education was safe, both for students, for their families, and for the faculty and staff.
And are you still in contact with Mr. Evans or with the COVID team here at Westminster? And if so, how often do you communicate with them?
Yeah, I can't remember exactly the last time that we've talked. I'm available, but I think things are going pretty well. So I'm not sure there's a need for ongoing discussion. I think that the places where I think there could be trouble, really this question of community transmission of variants is the thing that I think would be worrisome. And we don't know exactly what level that those other viruses are in Georgia, but that would be the concern, that in the frequent testing that's being done, the numbers of cases increases from the baseline that's being seen. And particularly, I think the thing that wasn't seen and would be a particular danger sign would be an outbreak where it's clear that there's been in-school transmission, and that wasn't seen during the first semester.
And as we approach the 1-year mark since Westminster went virtual and the rest of the world locked down, how much longer do you think COVID will affect our day-to-day lives?
I think it's going to be, I think this question of when are we going to be back to normal, I think it's not going to be one day it's like 2019. I think there will be a gradual relaxing of restrictions. You're wearing a mask. I think that could be one of the last things to go because it's so easy to do and does provide a high degree of protection. So I think that probably what will happen is that there'll be more as the vaccination program continues and there are fewer and fewer cases, that there'll be a relaxing of some of the business related restrictions. And so people will probably be able to go back to their offices, and restaurants will become more normal. The hospitality and travel industries will kind of relax. So I don't think there's going to be one day like June 1st, we're back to normal. It will probably be kind of from now, maybe through the next year, that there'll be individual behaviors restrictions that are relaxed, and then behaviors that change.
And as more of the population begins to get vaccinated, how will that help put an end to this virus and help us to return to those regular lives that we have?
Right. Well, the way that transmission will end is that the virus will not be able to find people who aren't immune. And people can either be immune by having been infected or by being vaccinated. And so it's kind of a math problem that when a person who's infected can't infect additional people, and particularly if they can't infect more than one person, the number of cases will drop. And that's actually what's happening right now. It's probably not, the vaccine is having some impact, but probably not a huge impact. But when that level of immunity in the population is high enough, the virus just won't be able to find susceptible hosts. There's a lot of questions in that, and I think maybe one of the biggest ones is there's the virus variant question. But even without that, how long a person who's infected or a person who's been vaccinated, how long they stay immune from being infected with the virus. That's not really something that's known right now. And I think that's kind of an ancillary question that goes along with the virus variants, that those two things will determine how much longer we're all living the way that we're living these days. Even with all that, there's a human behavior element, and some people are going to feel comfortable earlier than others. So I think that's why there'll be this gradual, once the pandemic really is over, there'll be this gradual return to normal. And probably not for, I think that in the fall, if all goes well, school will be more or less normal. But some of the other parts of the economy maybe won't be, like the hospitality industry with restaurants and, any kind of event that causes crowding people are gonna, I think, be reluctant to expose themselves in that way.
As I've mentioned quite a few times already, the U.S. is reaching that 1-year mark, and a lot of people are starting to get tired by following the COVID guidelines and protocols. And why is it important for COVID fatigue not to cloud people's judgment?
Well, I don't think that as the closer we get to the end, of having to do these things to keep from getting infected, the mask wearing, the avoiding crowds, the hand washing, it's almost like what you have to do compared to what you've done is less. And so the opportunity to get to the end without having a big problem is even greater. I think it is important for people to kind of double down at this point in time. And especially to get vaccine when it's available. I think when your group is reaches that stage, I think that as the months roll on, there'll be more and more vaccine available, and there'll be continued opportunities to get vaccinated as we approach the end of this, hopefully.
What are some important reminders to the Westminster community and everyone in general, like you just mentioned a few, about staying safe during the rest of this pandemic?
Well, I think the big ones are, I would say get vaccinated is one of the new ones, but wearing masks, avoiding crowds, avoiding travel. I think it's a real challenge for families that have children that are if they're an in-person school out of state, so in a university, that's a real challenge. But I think maintaining the measures that have been put in place, mask wearing, avoiding crowds, hand washing, the travel issue is a fourth element to that triad.
Thank you so much for taking time out of your busy schedule to speak with us, and we are so grateful to have you as an advisor to our COVID team here at Westminster.
It's been my pleasure to talk with you today.
And to our Wildcats, stay safe and go Cats.